morning, everybody. Calimero. I don't know about you. I don't think I've ever been at a conference that started so passionately. I mean, I live in the Brussels bubble, and for sure I'm out of my bubble right now. Brussels is an atmosphere of compromise and people trying to find middle ground and a lot of platitudes and soft talk. And I don't think, I think we should, I'm going to try and bring some of this Greek passion with me back to Brussels. I don't know what I'm going to say this morning that hasn't already been said. It seems there's fertile ground for what I'm about to say. And I was thinking as I was sitting there listening, what is it? What is it that I can say? And I suppose the only thing is that perhaps you're not alone. Everything you're going through and everything you're discussing is being faced all over Europe, I would say, whether it's in the south, in the north, in the east, or indeed in the west, where I'm from, in Ireland. About 20 years ago, 30 years ago, this is how the world looked. Blue skies, green fields, we were all quite comfortable, budgets were good, growth was good, citizens were happy. And then this happened a number of years ago, and I think this country in particular knows the pain of exactly how this feels. My own country, Ireland, has a little bit of it as well, but I don't think as deep as this country has felt. It's not the same environment anymore. It's not the same world anymore. We used to talk about crisis. We all know the crisis isn't a crisis anymore. It's not even a trend. It's the new reality. This is where we live. There's turns in the road. The weather's bad. It's not the same place. I was asked to come to talk to you this morning about, well, can medical technology help in particular in the sustainability of health? And I think it can. And I think I need to maybe explain what medical technology is first, and then maybe its role in sustainability. Sustainability, it's a word I hear, and it's banded around in Brussels as well. And I think it's a bit overused word. And I think if you went to the citizen in the street and talked to them about the sustainability of your health system, I think they might not know what you mean. Whereas if you talk about the affordability of their health system or access to their health system or being treated in a fair way, I think they understand what you're talking about. So I think maybe this sustainability word, we have to find another word that's a bit more real to our citizens. It's a bit like the word innovation. A lot of our companies use the buzzword innovation for a long time. And I can tell you that a lot of the chief executives in particular are getting a bit tired of it. And I think people are getting a bit tired of even hearing it. I'm sure health ministries and purchasers are a bit tired of hearing it. We need another word. It's about, I suppose, giving what people need and giving value to what people need. So can medical technology help? And first I wanted to talk a little bit about what is medical technology, because very often we get confused with other technologies and who are we. We're not small. Europe is consuming about 100 billion euros worth of medical equipment and products and solutions and software and management systems a year. About 10% of what we earn, we reinvest back into R&D, and there's about 25,000 companies in Europe. 80% of those companies are SME based, and if you go into the IVD sector, it's even 95%, so very small companies locally operating, trading either in Europe or globally. There's nearly 600,000 people employed in Europe in this industry, typically in very good, what we would call perhaps white-collar type jobs and good quality jobs. And there's about 500,000 products in the system, of which there's about 100,000 different types, but about 500,000 products circulating, so that's what's being purchased. We're very innovative in Europe, and an awful lot of the technologies and the newer technologies that you've seen were first invented by physicians working with European industry in small startups, innovative entrepreneurs, and that technology then is typically picked up by the larger or middle-sized companies, which are typically US-based, and so we see the technology head to the US before it's re-imported back into Europe. We're the leader filer of patents in Europe. There's a patent every 38 minutes, so there's already been a patent or two filed since we started this conference. So it's way ahead of any other industry. The way we develop products is very fast. If you make a product, you get feedback immediately from the physician or the user that says, well, it's great, but it would work better if. I mean, think of anything you use at home or the iPhone in your pocket or whatever you use. The feedback from the users typically leads to an improvement in 18 to 24 months. And I'll talk a bit about that later when I talk about innovation. Spending, and we've heard people talk here about the spending on healthcare. The spending on healthcare for medical technology alone is about 7.5%. I think you're a little bit above the average here in Greece. And the rest is spent on infrastructure, salaries, pharmaceuticals, other products. We've heard it here about what's going on and the crisis, and I just want to talk a little bit about what's driving all of that, the figures behind it. One is demographics. We're all getting older. I'm about to turn 50, and soon I'll enter this bracket of the group of people who are going to be over 65. So by 2040, if you look at Italy, we'll have 40% of the people over 65. So large amount of consumers of health are going to exist. What's the other dynamic in there that's causing a problem? It's the number of people who are actively working and contributing to the economy to pay for the health of those people who are in the most need of the health, because you consume most health in your later years. And again, if we look at Greece, you have about 3.4 working people at the moment to pay for one person who's over 65. And in 2040, you're going to have 1.6 people working to pay for the people who are over 65. Again, coming from the EU and what Sanko says, and we heard it this morning, there's going to be less carers or workers to care for those people. So the Commission reckons about 15% less people able to care. So all of this is changing our environment, and I'm sure you feel it, and I'm sure you know it. Because we're getting older, there's increased incidence of chronic disease, so hence people are all talking about prevention. How do we pay for all of this? Well, we used to do it privately or publicly. Now I need to start doing it privately, and we start to see mixes. There's a shift from hospitals to community care. Again, in terms of how do we pay for all this, more professional purchasing going on, and conflicts then between purchasers and hospital managers and industry. Then we see increased technology, so more possibilities coming into the fray. What can we do with those? How can we prove them? More education, more educated patients, more aware of what's going on, seeing stuff on the internet, and demanding more care. So the system's under a lot of pressure. And people are looking for better health, and more people are looking for better health, but we've less money to pay for it, and less people to give it. So consequently, I would contend the health systems in Europe, not just in Greece, health systems in Europe need to adapt and need to change. Now, as I said, it's very easy for me to come from my Brussels bubble and come here and say that, and say the health systems need to adapt. And you might say, well, what about you guys in industry? You're part of the problem. You talk about being part of the solution, but you're actually part of the problem. Are you going to adapt? Something I can tell you about industry is that industry has adapted. Our membership of companies represents probably about 80% of all products manufactured, not only in Europe, but globally. And around 2011, probably too late, the industry looked at what it was doing and how it ran its business model. I mean, typically, medical devices, companies would have innovated and the thing would have been made of red plastic. Then they made it out of blue plastic and told you that this was innovation and it deserved a 20% premium over the other products, and don't worry about data, we'll bring it to you later, but you got to pay that price. And I think when the skies were blue and the grass was green, this kind of business model worked quite well, and people were happy to purchase products that potentially showed a good outcome or a good innovation. But did it really? Well, it didn't matter because we just kept moving along. So everybody was growing and it was fine. I can tell you that industry realizes that that model is over. Nobody will buy a product anymore unless it gives you a better outcome or reduces cost. And it's as simple as that. So business knows that its business model has to change, and actually most companies have already changed their business model. And this is the business model that most companies are trying to move to or go towards, which is really understanding what's changed in the environment, that it's not just about what the doctor might need. It's not just about what the patient might need. It's also what's the insurer need, what does the health system need, what does the health minister need, what does the regional manager need. And then trying to build that need into, well, what technology can I offer to meet that need? A lot of our companies used to develop a new product, newer software, new whatever. Now they're realizing that's not actually what the purchaser wants or the health system needs. It might need a service around that product. So they start working with services around that product to offer. So that's the different change. The other change then is data and knowledge in education. The industry realizes that it's done an absolutely, I would say, awful job of bringing data to prove its innovations. Potential is there, but actual hard data to help somebody make a purchasing decision or help somebody make a political decision has been missing. So the industry knows it has to generate this if it's to be taken seriously. Let me talk to you a bit about the history of where businesses came and why is it like that. Traditionally, medical technology was developed because a doctor worked with an industry to make a product. A doctor needs a scalpel, he goes to someone who makes steel, makes knives, they make a scalpel, we have a scalpel. This was the way it worked, and this kind of physician-driven innovation served, I would say, patients very, very, very well. And this, I think, was the model for nearly centuries. Then you had the technology push model with the advent of new materials in the last 20, 30 years, the dot-com revolution, everything else, and the possibilities were there. What can we do with health? What can we steal from the space industry, the aeronautics industry, to put into health to make life better? And then we see this kind of medical technology evolving. Absolutely fantastic, blow your mind away, but is it reliable? Is it useful? Do we actually need it? I don't know. I myself am wearing one of these Fitbits here. I find it useful, but is it value for money? I don't know, yet to be proven. The kind of model I think we have to adopt is this type of model, where we combine those things, but we bring in the needs of the patients and the needs of the health systems, have to be built in. And then we can start, maybe as an industry, bringing products that society and patients actually need and actually see the value out of because they've asked for that value. Some examples of things we can do, but maybe are they going in the right direction? I don't know. I'll talk about that in a second. Remote monitoring can save up to 250 million euro a year. I mean, these are real numbers. Wound care, different types of wound care can save up to 70 million euros a year. So ideas are out there, but do they have a home? So industry, just to let you know, has changed. Industry is no longer just going for the technology push model, but is moving to a model of innovation that's really aimed at what are the patient needs, what are society needs, and we call this value-based innovation. How can it help? This was the question. How can it help in health systems? Because we're moving beyond products, it's not just products, it's services, it's the data that our products generates, it's continuum of care models, managing the patient care from prior to the hospital, in hospital, and after hospital care, providing services around this. We can help patients. We can help patients be more compliant. We can have patients more knowledge, information. This is what technology can do. Remember that 15% gap that we're going to have to fill. How do we care for more patients or more people? Well, we can provide technologies that will help fill that gap. It always surprises me that in every single other area of life, whether it's farming, accountancy, running your own home, wherever you have to do more with less, you always innovate and turn to technology to do more with less, always. And we never do this. This doesn't seem to be an automatic adjustment in health. There seems to be a fear of moving to technology in order to help. I mean, I remember when my own mother got her first automatic washing machine. And so from dealing with a family of 6 and having to spend all her day out of her washing machine, she didn't have to do any of that at all. She now had more free time to do what she wanted to do. So saved more time by having technology. It's such a simple thing. We do it in every other area of business. You do it in your own home, and yet we seem to have some sort of mental block when we apply it to health. In the same way, we can help health institutions, hospital managers try and run their organizations more efficiently if we have a frank exchange of views. Health systems. I always feel sorry for the health minister because certainly in my country in Ireland, it's a portfolio nobody wants because it's only going to be bad news, and the finance minister always has his door closed to you, always. So how do we help them get over that and get through that and make that door open so that actually, as I heard today, which I think is a phrase I'm going to steal and borrow, is that the health is seen as an investment and makes a competitive edge for a country. If that can be done, that can be fantastic. So here's my ask, and this is what I think. And I can tell you that we will not only see it happen here in Greece, but this is something we'll be pushing for in Europe as well. We want to see EU and national platforms to try and get the dialogue going. Because there's no point in us as industry saying, listen, we have all these great ideas, unless we all work in it together to try and figure out, yeah, but where do the ideas go? What are the needs? What can we actually do? I actually think we need platforms for frank exchanges of views. I heard some very frank exchanges of views here this morning, but they need to happen in a constructive way where people say, okay, I've got everything out there now. Now what are we going to do? How do we help? How do we measure? How do we move forward? I firmly believe that these platforms only work if they're sponsored at the highest political level, so either prime ministerial or ministerial level. They have to be inclusive. They have to keep patient-centeredness as part of that. They have to keep a health as an investment approach as part of that. I would think that they need to involve all stakeholders, and I think it's about overcoming barriers. And lastly, it's about managing the impact. We're actually going to have to change the way we do things, and that's going to hurt a lot of people. It's going to hurt industry, it's going to hurt health professionals, hospital managers. Everyone's going to take a little pain, but how do we manage that change? And it's only through dialogue you can do that, and only through a frank dialogue that you can actually do that. So I think if there's anything I would say to you is try and create this. I know we will push for this in Europe. Those of you who work in Europe know that typically everything that happens nationally was probably discussed and was decided in Brussels. So while we live in a bubble, something like 60 to 80% of all national laws are actually decided in Brussels, not nationally. And I can tell you that most thinking and implementation of national policies were typically decided or discussed in Brussels 5, 8, or 10 years previously. So there's discussions happening in Brussels today on the Juncker new Commission about what Europe will look like 2020, 2030, 2040. So if we can form these platforms, we can drive our future policy. And again, this is the world we live in, but now I'm in such a beautiful place. If we work together, I firmly believe we can change it to something that's a little more southern and a little more hopeful for all of us, and particularly for patients. Thank you.